I recently shared a video about therapeutic tools in pelvic floor rehab, and I highlighted some of the tools that we have here in the clinic to help our patients with whatever symptoms they're having with their pelvic floor. I had a follower reach out in DMs, and she wanted to know what each product was for and what it was used for, the website where she could go buy things. And it's hard for me to answer that because I'm here to guide people one-on-one and create a customized plan based on what's going on with that person. And so without having more information, just giving a whole bunch of tools to fix pelvic floor dysfunction is a disservice to this person. So what I decided to do is take this really good question, and I'm going to highlight each one of the products and give you just a little information on each one. If you want the longer videos, I'm happy to also link the Ed Talk playlist to my YouTube channel. That way you can learn a little bit more. So here we go. The first video I'm going to make here is the vaginal weight. These are made by Intimate Rose. Comes with a set of 6 weights that can be inserted vaginally, and they're graduated. So this one, the lightest color, white one, is the lightest in weight. And I don't have it off the top of my head how much these weigh. Then we get up to this dark purple one here. It's pretty heavy. Now, vaginal weights can be used to help train the pelvic floor muscles. A lot of people, I will say, think that they have weak pelvic floor muscles when they're having pelvic floor dysfunction, like if they're leaking, or if they have prolapse, if they have pain. That is not always the case. So we don't often recommend these, but they have their time and place. And this is something that us as physical therapists help guide people on how to use these and when it's appropriate. But in a nutshell, these can be used to help train the pelvic floor muscles, to help the brain connect in with those muscles and learn how to contract. Okay, next up is the Ohnut. It's a product made by the Pelvic people. It's actually a series of silicone rings like this. They're very stretchy, they're very soft, and I showed in my video using a vaginal dilator to kind of simulate, could be a sex toy. Yes, it looks like a dildo, it is not, or it can simulate a penis. So basically, the Ohnut is used for pain with penetration. So that could be from a toy, it could be from a person. So what these silicone rings do is they can go on the base of, let's say, penis, and they can be stacked. Multiple of these can be placed on. So that way it creates kind of a buffer between the partners. So for some people, they have pain with penetration, with deeper penetration, maybe because their partner is longer than what they're able to accommodate. So basically, this is going to just create a buffer and help with penetration and the depth. Okay, so I have my little vulva puppet here, so you can just imagine as this goes in, it's going to stop from fully being able to penetrate. From what I understand, this does not interfere with pleasure of the male. Okay, so these are not very tight, and if anything, it's just going to allow both partners to be kind of in the moment without having to worry about the depth that he needs to go to prevent causing pain to her. So again, that's the Ohnut, and it's from the Pelvic people, so you can check it out. All right, the next therapeutic tool is the Kiwi. It's also made by the Pelvic people. Looks like this. Comes with a nice little booklet, so I won't go into all of the things, but basically it's a little vibration tool. You can see how it has kind of a broad end here, a little bit more pointed there, and really pointed here. It comes with 2 motors. I'm going to turn them on. It's going to vibrate. You're going to see this. Maybe. Oh, I have to do one at a time. Hold on. Okay. And now you can see that little end. All right. So this I showed with my little silicone model here of just kind of going around. So what you can do is use it along the buttocks. It can be along the inner thighs. It can be used along the perineum, that area between the vaginal and anal openings. It can be used for clitoral stimulation. Basically, this is a tool that can help with pelvic pain prior to intercourse or to help with intercourse. I'll tell you just a little bit with this. You can change the intensities. You can use one motor or both at the same time. I'll let you play around with it if you decide to get this. However, it can be a really good tool to, like I said, help with intercourse. So for some women, they can't do penetrative intercourse because it hurts and they're not to that stage yet. Maybe they're working with someone like myself that's trying to get them there. So this can be a tool that can be used for pleasure, but also to kind of prepare the pelvic floor muscles to relax, as well as bring blood flow to the area. Also, I will say for some women, it helps if they actually orgasm first because it relaxes the pelvic floor muscles prior to penetrative intercourse. So this can be used at the discretion of the person using it, okay? But that's just kind of a little bit of information about the Kiwi. Again, it's made by the Pelvic people, so go check them out. Okay, next therapeutic tool are the pelvic wands. These are also made by Intimate Rose. They are coated with a nice soft silicone. You can see how they are all shaped the same. They're different colors because they have different features. I'm going to go over in general what we use a pelvic wand for, and then depending on how long my video is, I might show you what the different features are. I'm going to take this basic one. It's got no bells or whistles, but you can see how it is shaped in this particular way. It's a little thicker on this side, a little shorter, and it's thinner and longer on this side. This one's kind of hooked. This can be used to do pelvic floor release into the muscles. It can be inserted vaginally. I'm just going to take the vulva off of my model. This can be inserted right at the entrance to kind of stretch out the tissues right at the entrance, those muscles. Or it can be used to angle, if I can show this. Let me use my yellow one. It could be angled into certain spots of the pelvic floor muscles to get deeper back into towards the coccyx, those muscles that attach right onto the coccyx. It can be angled towards the front side to get behind the pubic bone. The other end can be used to get into trigger point areas wherever it's needed. This can also be used rectally as well. Some people need to insert rectally in order to come up and release the rectal tissues, but also along the coccyx itself. So for that reason, it's got the two different ends and I guess variability or flexibility. I don't know if I want to say that. Anyway, we have a little bit of time here. This one has no bells and whistles. This one here is a temperature one. It can be either cooled down or it can be heated up. And this one here is a vibrating one to help to just neuromuscularly stimulate those muscles to get them to relax a little bit more. All right, next up we have the vaginal dilators. These are made by Intimate Rose. There's other brands out there. These are just the brand that I choose to have in stock to educate people about, and they're the ones that we trust. So you can see they come in different, not different shapes, but different sizes. So we have here is the smallest one. You can see how these are made of silicone. They're very soft, I will tell you. And they come in graduated sizes depending on what somebody needs these for and where they're starting out at. Typically, we use these for stretching out pelvic floor muscles. So things like vaginismus, pelvic pain, pain with penetration, whether that be inserting a tampon or pain with intercourse. Those are some of the indications that we might use dilators for. Also post-surgery. So you can see here that the dilators, they jump up in size. So depending on the goal, this is going to be probably more like if you have penetrative intercourse with a male, then you're going to probably go for something along this size and depth and length. Okay, you can see how this smallest one is quite a bit different than the biggest one. Okay, how do we use these? Basically, they're used to, I'm going to use this yellow one because I think that's what I showed in the video. I'm going to take the vulva off of my model here so that I have an entrance. But this can be used right at the entrance to stretch out vaginal tissue, to stretch out muscles, and it can be used also to get in a little bit deeper and kind of angle it to where it needs to go. It can be used to stretch out right at the entrance there, again, as well as deeper. So those are vaginal dilators. I'm not going to go into all the ins and outs about how we use them and how we prescribe them and positions and things like that. But that's in a nutshell. You can check it out. Okay, last video in our series of therapeutic tools for pelvic floor rehab are the rectal dilators. These are also made by Intimate Rose. You can see they're made out of silicone. They come in different sizes and slightly different shape because you can see here with the smaller one, it's pretty straight and it's pretty narrow versus this bigger one. This is the biggest. You can see how it's kind of graduated. It's got a little bit more at the base here and it's thicker here at the tip. Okay, and it's quite a bit longer. So why do we use rectal dilators? Well, we work with a lot of people that have problems with pooping. Okay, they cannot get a good poop out. And that can happen after cancer. It can happen for a lot of different reasons. Constipation can happen for different reasons, even from stress. All right, so the Rectal dilators, of course, are used rectally. So I'm going to show you here on a female model. We have the vaginal opening here and the rectum there. So you can imagine this being lubricated and being able to be inserted to stretch out the external anal sphincter muscles right at the entrance or exit, however you look at this, as well as to be inserted in to stretch out those muscles along the rectum. So you can see, again, going back to the different sizes and shapes, how this is going to accommodate more of a bigger bowel movement and allow that to pass a little easier. Now, I will say that rectal dilators can also be used for training for rectal intercourse, if that is something that is a goal of yours, okay? So again, these are made by Intimate Rose. By all means, reach out if you have any questions and if you want some guidance, in particular, one-on-one, virtually, or in person. The thing I want to point out is that with these therapeutic tools that I'm highlighting is that you can Google this information. You can probably find that information, not just from me, but out on the interwebs, right? So the thing is that I feel like us here at the Healing Spot with our therapist, myself and Natalie, is that we provide guidance for people. We help to take our expertise, what we know, what we have taken years as well as many, many hours of training, to bring that to you in the form of guidance, to know how do we apply these tools, what's appropriate for you, what do you need or not need. These are therapeutic tools that some of our patients use, but not all. And I can also say that they can look kind of intimidating. Some of them look very intimidating, and it's us getting to know our patients and their history and their story and them to determine what we're going to recommend.